I'm Shannon Chyma, and I'm from Marshall County. I am the Tobacco Prevention Coordinator for Marshall County, and I've been at this position for about 7 years. And today I'm going to talk to you a little bit about Quitline and specifically brief tobacco cessation, which is called 2 A's and an R. We'd like to talk about 2 A's and an R for brief tobacco cessation, and the 2 A's are ask, advise, and refer. These are used with healthcare providers, and it's our job as community consultants to go to these offices and make contact with the healthcare professionals. I've had some success with it, so I've been asked to talk about it a little bit. And the main question we've been getting is, how do you get your foot in the door to these offices? We've been lucky with our partnership because we have a relationship with our primary health care providers, and they have a staff meeting that we're invited to every quarter, so I'm always able to go in there and talk to them, and that's really nice. If you're not able to do that, my advice is, if you have a relationship with one of the general practitioners or even your dentist, I've been into my dentist before too, is to ask when you're in there for your appointment. Ask them what they do for tobacco cessation. I realize that many of you have lots of counties. I only serve one county, so I've been lucky enough to live here and have a relationship. I know lots of you don't. You could call, but I have found it's better to just walk in and tell them you're just there. You are the community tobacco prevention coordinator, and you would just like a moment of someone's time to talk about brief tobacco cessation. If you have to wait, that's fine. Just tell them wait. When would be another better time? If you could find out when they have like a partnership meeting or a staff meeting, that would be great. And you don't need more than even 5 minutes. So make sure that you tell them that. That's not going to take you long at all. And it's a service to them that you're going to help them. When you get into the healthcare provider and talk to them about the Quitline, I often take in this flyer because it has the address for this training. Down here it says, click here. There is a training on there. A person needs to register on there, and anyone can take it. Community partnership consultants can take it. Of course, we're trying to get the healthcare providers to take it. It's good for you as a healthcare consultant to take it yourself, so you know what you're asking the healthcare providers to take. On there is a form on how they are supposed to fill out. It's a fax referral form. That's what we're trying to get, is more fax referrals. And on that form, it's best to take that in with you and then just go over the form with whoever you get to talk to, whether it be a nurse practitioner or whatever. And we've been having some problems with the wrong number being on there. So this fax referral form, if you take it with you, it has the correct number on there. And then if you just go over it with the healthcare provider, so they'll know what to fill in. Also, we have a generous supply of buttons that we've been handing out when we go in. So what you're going to leave them with is the fax referral form, flow charts, the button, and I want you to go over the fax referral form with them.
Hey everybody, now Geralyn's going to tell us just a little bit about the new Quitline provider website.
The first thing you want to do is go to quitlineiowa.org. Once Quitline Iowa comes up, you go to About the Program. And then there's a tab now called Provider Resources. Under Provider Resources, you can find cessation support available to Medicaid members, how to refer patients. There's a link for the fax referral form, and it has the new number that you want to make sure is there. You want to make sure you're using the proper fax referral forms. If you're looking for the Medicaid fax referral forms, there are 2 of them depending on what type of medication the provider is prescribing. If it is a NRT, you need to go, if it is the Chantix or bupropion, you need to make sure you're in the smoking cessation therapy oral. If it is patch, gum, or lozenge, be sure you use the nicotine replacement therapy prior authorization. Please make sure that your providers know that there is a difference depending on what type of medication they would like their client or patient to use. And then fill this out. Also on this page is the Iowa Substance Abuse Information Center Clearinghouse, and this is where your providers, as well as you all, can go and receive tobacco items. Here is a listing of what is available to date. Keep watching this and tell your providers that they need more brochures, that they can also come out here and order those. Lastly, on this page is the Tobacco Use in Iowa Brief Tobacco Intervention. This is the online training that is for healthcare providers or any type of allied healthcare provider that will walk through the 2 ways in an R, what Quitline does, what Quitline can offer, and you just register, and there is CMEs available to this, and it is 1 credit for taking this online training.